Hello friends, welcome back to Learning Nails and Aesthetics. We are in the Milady Esthetics book, chapter 8, page 310. Don't forget to comment, like, share, and subscribe, as well as check out my other videos. The Milady Esthetics book, this one, the Milady Nails book, as well as their companion book, Milady Foundations. Also, some other fun unboxing Temu products, Beetles polish, and other brands. Keep in mind, I am not AI, so mistakes will be made. Proper client draping and hand washing. Drape the client properly by adjusting the head drape, pillow, and linens following your instructor's method. Place a towel across the client's chest and a cover over the body as directed. Drape the hair with a towel or headband as necessary. Check to make sure the headband is not too tight and that all the hair is covered. A bolster placed under the knees supports the back, and a pillow can be used for the client's comfort as needed. Be sure to follow the protocol outlined in Procedure 8-1, pre-service, preparing the client for treatment to ensure proper draping of the client. The proper draping of the client is very important. Wash your hands before analyzing the client's skin. Figure 8-1, which shows a person washing their hands. Perform an initial skin analysis and agree on a treatment plan. Before cleansing, inspect the skin type and conditions. Is it dry, normal, or oily? Is the skin texture smooth or rough? Are there fine lines or creases? Are there blackheads or acne conditions? Are dilated capillaries visible? Is the skin color even? You want to see the skin's natural state before cleansing, and then again after cleansing, especially if the client is wearing makeup. Figure 8-12 has a picture of a client on a table and an esthetician looking at her face. Ask the client what their skin concerns are. Listen carefully before you respond. Help the client to relax by speaking in a quiet and professional manner. Create a treatment plan. Once you have familiarized yourself with the client's skin and their concerns, you need to formulate a clear and precise plan of action. Create a treatment plan to show your client that you are educated and prepared to treat the concerns they may have. Explain the benefits of the products and service you offer and answer any questions the client may have. Figure 8-13 is a chart that we will read here in a sec. Is a sample plan to develop the treatment you will implement for the client. Cleansing. And then you're supposed to mark. Let's see if you're able to look at this. It's not very big. It'll only take a minute to look at it. If you're driving, no looking. So, cleansing, and then the procedure would be a cream, a liquid, a mousse, a gel, or steam, hot or cold, and you're supposed to select one of those. Exfoliation, AHA, BHA, enzymes, microdermabrasion, or a rotary brush, again, select. Advanced protocols, galvanic, high frequency, microcurrent. Massage, oil, cream, gel, or serum. Then a masks, sheet mask, cream, mud, clay, alginate, or mineral. Complete the facial cleansing with appropriate cleanser and toner. After the initial dry skin analysis, some estheticians prefer to apply warm towels for a few minutes. Warm towels can be used before cleansing to prepare the client for your touch, to warm and moisten the skin, and to make cleansing more effective and enjoyable. Always wash your hands before starting any treatment and put on gloves. Cleanse to remove impurities and makeup before the in-depth skin analysis and facial treatment. Figure 8-14 shows a client on a treatment table, and the esthetician looks like cleansing their face. Proper cleansing is imperative to the success of your facial treatment because not all skin types and concerns are the same. There are many different cleansing formulas, from rich, creamy cleansers to lightweight, foaming cleansers. Based on the skin analysis, choose a cleanser based on the client's skin type and concerns. Cream-based cleansers are for dry to more mature skin types. Mousse is for combination skin, and gels and liquids are for oilier skin types. Remove eye and lip makeup. Before starting the cleansing procedure, the client's eye and lip color can be removed. Figure 8-15, which is on the next page here. Make sure the client is not wearing contacts. If they wear contacts, they will need to remove them before receiving the treatment. Do not use too much cleanser because it can run into the eyes. Some clients prefer to leave on their eye makeup, which typically is appropriate only if the client is having an express treatment. For a full facial, all makeup should be removed. Clients may have the opportunity to have their makeup reapplied following the full facial if this is a service you offer for an upcharge. Caution! Oh, again, the red circle with the exclamation mark. Caution! If any product gets into the eyes, rinse and flush the eyes immediately with water and cotton, then resume the procedure. I always hand my clients a small towel, a cloth, just in case. These products can run into their eyes as well as into their ears. Of course, you want to make sure that does not happen, but it can. All right. And it is better for them to have something they can wipe with quickly. Okay, here we are. Figure 8-15. Remove eye and lip makeup. That's a picture of a person doing so. Figure 8-16. Complete the skin cleansing. Cleansing. Avoid over-rubbing or overstimulating the skin, and thoroughly but efficiently complete the cleansing. If there is makeup residue, do a double cleansing, once before using the towels and once after. Toners. Some estheticians use a toner between facial steps to remove any makeup or product residue. Most facial products can be applied with fingertips and removed with aesthetic wipes or sponges. Toners, tonics, and astringents are all referred to as toners for simplicity in this text. Toners refresh the blah blah blah. Toners finish the cleansing process by removing any residue from the cleanser left on the skin and help restore the skin's pH balance. Astringent formulas can help reduce the appearance of the pores, while toners and tonics can help remove excess cleanser while helping to tone the appearance of the skin. Different formulas can also help skin problems such as dehydration and acne. Toners can be misted onto the face or applied with a saturated cotton pad. Figure 8-17 just says toner can be misted onto the face, which the esthetician is doing. Perform Procedure 8-2, remove eye makeup and lipstick. Procedure 8-3, apply a cleansing product. Procedure 8-4, removing products. In-depth skin analysis. Analyze the skin after cleansing. Accurate skin analysis is the most crucial step in recommending the most effective professional treatments possible. The examination should be conducted with careful concentration. Complete a thorough analysis with a magnifying lamp, a Woods lamp, or an electronic imaging system after cleansing. Figure 8-18 shows an accurate skin analysis is crucial and is a shot of a person's face magnified through a magnifying lamp. You should be prepared to recognize and treat any combination of skin conditions. Check for any other conditions or contraindications prohibiting a facial. A full list of contraindications for skin treatments can be found in Chapter 5, Skin Analysis, on page 178. If you are ever unsure, wait and have the patient obtain clearance from their physician for facial treatment. As you learned in Chapter 5, Skin Analysis, the 4 components of skin analysis are look, touch, ask, and listen, and then record your findings. Table 8-2, Skin Analysis Checklist. Analyze the skin using a magnifying lamp. Place eye pads on the eyes. Try not to cover what you need to look at around the eyes. Perform the steps in the following checklist. Look for any obvious skin conditions and note the skin type. Touch the skin, noting its elasticity, softness, texture, and skin condition. Continue the consultation, asking questions while analyzing. Analyze the pore size, hydration level, pigmentation, muscle tone, broken capillaries, facial wrinkles, signs of skin disorders, and so on. Choose the products. Note the information on the client's chart. This can be done before, during, or after the facial. Client charts. During the skin analysis, it is necessary to keep the client's chart on hand to write down any information or changes that have occurred in the client's skin, even if the client is a regular and you are familiar with their skin. Figure 8-19 shows an esthetician holding a clipboard, which we're to assume is the client's chart. It is very important to keep track of any changes. The client's chart should be filled out and used as a reference each time the client returns. Keep an ongoing file for your client, just as a doctor does. All procedures and products used during the consultation or treatment should be recorded for future reference. All products purchased for at-home use should be noted in the client's electronic file or service record card as well. The esthetician must train their sight and touch to know what to look for during skin analysis. Review the questions to ask during the consultation. See Chapter 5, Skin Analysis, on pages 186 to 187. Note: be sure to ask about the use of retin-A and glycolic acid because the skin is more sensitive when such products are used. You may have to avoid mechanical exfoliation, brushing machines, or chemical peels such as alpha hydroxy acids, AHAs, with a pH lower than 4.2, and use only products that are pH balanced and designed to soothe the skin. Exfoliation product or mask. Exfoliation can be achieved by using products such as AHA, BHA, manual scrubs, or enzyme peels, or you can use the brush machine to remove dead skin cells that make the skin feel rough and clog the follicles. Exfoliation makes the skin smoother, helps product penetration by unblocking the surface, and promotes stimulation, which increases cell turnover rate. Exfoliation methods include mechanical exfoliants, chemical exfoliants, and electrotherapy. Exfoliation products are discussed in Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection, and in Chapter 10, Facial Devices and Technology. Here's a quick reminder on types of exfoliation. Mechanical exfoliation is the use of the rotary brush or microdermabrasion. When applied to the skin, this will gently remove dead skin cells and aid in a deeper cleansing. Figure 8-20 shows microdermabrasion as an example of mechanical exfoliation and a picture of a client receiving this treatment or procedure. But Florida law, we're not supposed to call it a treatment. So Figure 8-20, granular or manual exfoliation is the use of a granular product such as honey and jojoba beads or rice bran wax to help remove the dead skin and debris by manipulation with the fingertips. Chemical exfoliation such as an enzyme and alpha hydroxy acids, AHAs, beta hydroxy acids, BHAs, azelaic acid or kojic acid can be chosen based on the level of accumulation of dead skin cells and skin sensitivity. Figure 8-21 shows a client receiving chemical exfoliants can be used to lessen the appearance of wrinkles. Disincrustation solution can be applied to loosen sebum accumulation in the hair follicles, making extractions easier. The solution softens the sebaceous material, oil, dirt, and debris around the edges of the pores or follicle openings. Disincrustation with a galvanic machine is discussed in Chapter 10, Facial Devices and Technology. Chemical exfoliants are used to lessen the appearance of wrinkles and skin discoloration. Always apply sun protection with SPF 30 after any chemical exfoliation procedure, and educate your client on post-treatment. Clients must wear SPF 30 sunscreen every day following usage of AHA. Disincrustation with a galvanic machine. Use disincrustation solution or a mask if performing extractions. Disincrustation is the process used to soften and emulsify sebum such as comedones, blackheads in the follicles. For blackhead extraction, if the blackheads are very deep and have been lodged in the skin for a while, you will need to further soften the keratinized sebum. For this purpose, a disincrustation solution used in conjunction with a galvanic machine can be very helpful. Figure 8-22 shows a disincrustation with a galvanic machine, the client receiving the treatment. This is a solution that softens the sebaceous material, oil, dirt, and debris around the edge of the pores or follicle openings. This helps soften the comedones, making extractions easier with minimal trauma to the surrounding tissue. Steam or warm towels. Steam promotes more effective cleansing as warmth softens the follicles. Figure 8-23 shows a client with a warm towel on their face. Steam should never be used for longer than 10 minutes because it can cause overheating and redness and may cause irritation. Steam can exacerbate, I do not like that word. It can make it worse. Existing conditions, so never use steam on clients with sensitive skin, rosacea, or inflamed acne. Warm towels can be used in place of steam or for product removal during treatments. If using hot towels, always check the towel temperature on the inside of your wrist before applying. Keep towels away from the nostrils. And always ask if they're claustrophobic before you put it on their face. Little tip there. Use of the steamer. Steam is typically used before deep pore cleansing. Steaming uses a warm, humid mist to soften skin and allow for easier removal of comedones. The steamer nozzle is placed approximately 18 inches, 45 centimeters, away from the client. Figure 8-24 shows a esthetician pointing the nozzle of steam at the client's face. Check to make sure the client is comfortable and does not feel claustrophobic. The nozzle can be positioned above or below the client's face. Do not use on inflamed, hypersensitive, or rosacea skin. Refer to Chapter 10, Facial Devices and Technology, for instructions on how to safely and effectively use the steamer. I would like to add, I would not place the steamer nozzle directly over the client's face because hot water could drip out, not just the steam. Also, don't put it near them until the steam is coming out because, again, accumulated water can just drip out and you don't want that. Caution, again, with the red and the exclamation mark, so caution. To avoid overstimulation and damage to capillaries, do not use steam or hot towels on rosacea prone or cuperose skin. Use an additional facial mask instead. And that'll do it for this video. I hope this was helpful to you. We will continue extractions and or deep pore cleansing, massage, and so on in the next video. This is Chapter 6, Facial Treatments. Oh, no, just kidding. Chapter 8. Chapter 8. Don't forget to comment, like, share, and subscribe, as well as check out my other videos. And have a great day. Thanks. Bye.